Hi, my name's Iram Siddiqui and I work for Private Therapy Clinic. I started working as a cognitive behavioural psychotherapist in 2009. I also use a modality called eye movement desensitization reprocessing, which I trained in a couple of years ago. My main reason for joining this profession was mostly because I had a family member who was unwell, and I supported them through their journey whilst they were having therapy, and it interested me immensely, and that's when I decided that I wanted to do something in this field or related to this field, and I haven't looked back since. So I've worked in the mental health field for over 11 years. I have lots of experience working with different disorders. So I've worked with OCD, which is Obsessive Compulsive Disorder, generalised anxiety disorder, post-traumatic stress disorder, health anxiety, depression, low self-esteem, low self-confidence. Often I find that clients will come with, I often get a lot of these clients coming to me. So it feels like I get a lot of fulfillment out of working with those clients. But also I keep myself up to date with all the skills. So I go to lots of continuing professional development so that I'm up to date with the latest research. I'm often giving my clients new stuff that literally has just been researched and come out. I'll be learning it and then giving it on, passing it on to my clients. I also work in different languages, so I speak Urdu, I speak Hindi, and I also understand Punjabi and also speak a little bit. But I find that clients come to me with other languages, but also can actually get the full benefit of having therapy because I can use my language skills as well. I use my two main approaches are cognitive behavioural psychotherapy and eye movement desensitization reprocessing. So cognitive behavioural psychotherapy is used with all the major mental health problems that people usually come with. So health anxiety, obsessive compulsive disorder, post-traumatic stress disorder, depression, generalised anxiety, panic disorder, phobias. So these are sort of the main disorders that it would be used with. Eye movement desensitization reprocessing is mostly used with post-traumatic stress disorder, and both of these disciplines are actually NICE guideline approved for post-traumatic stress disorder. So I do use them. Sometimes a combination of both. Sometimes I will only use EMDR just for the trauma, and we'll end there. But CBT is a bit more of a longer treatment episode than EMDR. But I find that sometimes people come for EMDR for post-traumatic stress disorder, and they might use some extra sessions at the end just to finish off the work to do other things that they might be having difficulty with. Alongside these both therapies, I also have had a lot of training in compassion-focused therapy because it's something I actually believe in a lot in terms of working with your inner self-critic. A lot of people have a lot of self-criticism and they find it very difficult to let go of that. And sometimes using that compassion-focused therapy really helps in combination with either CBT or PTSD work with EMDR. Therapy is sometimes very helpful to use that as an extra discipline to just help people with that inner self-critic and removing some of those self-criticisms that people experience on a daily basis. When someone will first come to see me, we'll spend the first session just getting to find out what the difficulties are, where they began, you know, what's keeping them going, what changes do we need to make. But it's always interesting to think about therapy as you're investing in yourself. So when you're doing an investment in yourself, you have to think about what are your motivations. Now you've come into a room and you're speaking to a stranger about your difficulties. It's very, very difficult to come and open up in the first session. So sometimes it feels a bit like the things are getting a bit worse before they get better. But if you think about the saying, the calm before the storm, it's the storm before the calm, because you have a storm that you're going to go and erupt into a room, and then after that you're going to feel a bit unsettled, but eventually things will calm down. People report around session 4 to 6, things will settle down and be much more different. So it is about sticking with it and just going through it and really riding that out. Session 1 is always so important to get involved with each other and understanding what's going on and what we're going to do with it, and just sort of contracting for 6 sessions and saying that, you know, this is what we're intending to do in the 6 sessions. After the 6th session, you'll have a review, and then you can think about where you want to go from there. I usually find that by session 6, people are beginning to report differences in their lives or changes, and then they're thinking about where they want to be. But the first session is always about goal setting, thinking about what we're going to do, and then executing those goals. So in about 6 weeks' time, some of those goals have started to take shape, and so there is something to see visibly in terms of change. This is just obviously the beginning, but then after that it's about maintaining and thinking about ending, because therapy is, as I said, an investment. You're investing in yourself to make those changes, and then to keep those going, you have to think about, after this, where do I go? A very interesting case that comes to mind is somebody I worked with a while back, and when they first came, they didn't want to think about staying. They did a session or 2 and they weren't sure, and then they started seeing a few changes, and actually by session 12 they were saying to me, I can't believe that so much has changed, which was so rewarding for me, but I think it was interesting to see how rewarding it was for them. So someone who was sitting on the fence, not sure, but then after 12 sessions feels like everything's changed, was just so amazing to watch. When I was a university student, I used to think about what would be a career achievement, and I didn't actually have anything particularly in mind. I used to think, oh, maybe it'll be if you get a paper published, or if this happens or that happens. I did have a paper published, which I felt was a good big career achievement, but then after that I was actually invited back to my old university to be a lecturer as a guest lecturer. And it was so exciting for me that I remember walking into the university for the first time and thinking, so I'm not here today to learn, I'm here to teach. So it was really, really such a big achievement for me, because I never ever thought, being a student sitting behind those desks, looking up, thinking, oh, I'm actually going to be on the other side. So on this occasion, when I walked in and I was on the other side, I was thinking, oh, so do I actually have to do this now? But I think it's got to be the biggest achievement I've had so far. I'm sure there'll be more to come, but this one will always be in my mind.